you can take your injectable composite and you can load up cusps. You can create cusps with this because it's so stackable. One cusp here, one cusp here like this. And then at this point, you can cure it right there, 20-second cure, and then go ahead and then create the other cusps. Fill in here like this. Even creating the semblance of a central fossa. So that's one way to do that. Very simple. Of course, it's a smaller preparation like a fissurotomy, then you can just place it right in there. Then you cure this for 20 seconds. So this is one option you have, which I do quite frequently. And again, I'm doing a selective etch on that. Another option, if you want, is to use the genial bulk injectable. So here you're bulk filling this. And of course, when you see this, you say, I noticed some darkness coming through. So you may or may not have that, but I'm giving you the example of where it exists to give you a little insight as to how to manage that. So here you can load this up, and you could theoretically finish this off completely with the bulk fill, and it will wear like traditional composite. But to me, it looks very gray. So I'm leaving myself about 1 millimeter or so, or 2 millimeters of space, occlusal space or room, so I can place the opaque version of genial universal injectable. So that's the opaque A1, OA1, and it comes in OA1 and OA2. So here I cover that up, and I found in my experience, instead of trying to opaque down below, which we thought about many years ago, put some like a white baseliner in there, it never looked that aesthetic. It never looked natural. I found that this worked out the best, bringing the dentin shade or the opaque shade on the surface. That worked out masking everything the best. So here then you can build up those cups the way I showed you, do maybe the buccal first, cure that, and then do the lingual. So that's another option. There are 2 options that you can do there too. I use it, and certainly in all of them, especially class 1s, some class 2s, class 3s, micro class 4s, class 5s especially. That's a great application for these as kind of a soft start for you. You've got a lot of versatility with this. As I say, it can be used in all classifications of restorations. But also, what's fascinating is because we're dentists and we're accustomed to holding a syringe, this has a very natural feel and natural ergonomics. So here you're holding a syringe and you're placing your composite with that. So in other words, the placement is fast, and it also eliminates a composite instrument. So let's talk about how I treat the class 5 composite with injectable composite. Again, think of this as traditional composite in a syringe. It injects like flowable, but it stacks like traditional composite and wears like traditional composite. Also, when you're restoring a class 5, keep in mind that restoring this emergence profile will help at some measure to deflect bristles of the toothbrush and also food, which is the way the tooth was designed originally. How to quantize that, I couldn't tell you, but it can only help. So there's another benefit secondarily to that, to restoring that exposed dentin, which can be carious or non-carious, either case. Here's our lesion. Typically, I would give local anesthetic for this, and then we can excavate the decay and bevel. Usually, I'll do 2 to 3 increments here and cure each increment. And be mindful when you're at the cervical of a tooth, you're typically 1 shade darker. So if your tooth was an A1, go with an A2 at the cervical. It's an A2, do an A3. If you're B1, an A1. This way it looks authentic. And then here's the final restoration.